Is a full facelift a requirement, or are simpler, less invasive options available? I just turned 50 and lost 30 pounds about 6 months ago. I have dog bite scars and rhinophyma. I've seen some before-after pictures for CO2 lasers working wonders on the saggy turkey neck, and also fillers in the cheeks and tear trough areas that have given great results, but I would love to hear some professional opinions. I would like to avoid a full facelift if at all possible. My neck and expanding nose bother me the most. All suggestions welcome and thank you. We'll travel to California, Nevada, Arizona.
Thank you for your question. You're 50 years old and you stated in your question that you lost about 30 pounds 6 months prior and that you want to know your options, whether you need a full facelift or less invasive procedures. It is certainly helpful that you submitted your question with the number of photos that you did. So let's understand some terminology and what the goals are of a facelift procedure. And it's very understandable why you're confused, because it is common to feel, it's very generally accepted that a quote full facelift is a very invasive procedure. So let's get to some definitions. I'm a cosmetic surgeon. I've been practicing oculofacial plastic surgery for over 20 years. We do a lot of facelifts in our practice, and I've seen a lot of changes over the 20 years of what the term facelift means and how marketing has confused a lot of this terminology. When you look at your photo from the side view, you see that there is a loss of definition of jawline. There's also extra skin under the chin, and it extends down further along the neck. So when someone like myself sees this, when you do a physical exam, you vertically lift the face, you see how much of this area improves, and then you also pull behind to see how much of that area improves. Typically, someone in your situation would be a candidate for something called a face and neck lift. Now, what does that mean? Well, let's start by defining it by the type of incision, and then we can go into the different styles of facelifts. When we talk about the types of terminology that we use, such as short scar facelift, standard facelift, and face and neck lift, we'll differentiate it first by the size of the incision. A short scar facelift is literally that. It's a short scar that's made in the ear area, usually behind the opening of the ear, at least in my hands, and is meant to vertically lift and improve the jawline and elevate. And it can be very effective to do a lot through a relatively small incision. A facelift in my practice involves an incision that's above the ear in the temple and then goes slightly behind the ear to lift the cheek to the jawline and part of the upper part of the neck. And then a face and neck lift involves an incision that's the same as the facelift and then goes behind the ear to extend to the necessary amount to optimally put traction on the neck skin, which is sagging downward. Now, when you look at facelifts as a procedure, you'll see that many doctors claim to do the best facelift that's ever been done, and there are names associated, whether it's trade names or whether it's standard names that have become overused to appear to provide the appearance that one doctor does things better than another. A common term is deep plane facelift. And naturally, we always think deeper, bigger, it's always better. But there's a balance. The balance is what your desired outcome is, what you'll accept as a satisfactory result, combined with the level of surgery you're willing to do, the healing time that's involved, and of course the cost involved. So in our practice, what we've tried to do is reduce a lot of the negatives that are associated typically with facelifting surgery. We'll start with the anesthesia. We do all our procedures under local anesthesia with light sedation. And regardless of whether it's a short scar facelift or a deep plane facelift combined with cheek implants, chin implants, and more extensive work, we do everything under local with sedation. So patients feel very good about avoiding general anesthesia altogether. We do this procedure also in a way that this is very individual, but it's about the style. And a lot of times the decisions on the type of facelift you need are done during the surgery because we look under the skin at a tissue that's very important called the SMAS. The SMAS is the superficial musculoaponeurotic system. This represents what people refer to commonly as the muscle, but really it's a tissue that is over the facial muscles that transfers the activity of facial muscles to the skin. The SMAS is like the foundation, and when it sags, it's the continuation of a muscle called the platysma, and when it sags, the skin sags with it. So you can't just lift the skin alone, you have to also elevate the SMAS in whatever way is appropriate. And there are many, many different ways to do it, and it always goes back to what the individual surgeon finds works best in their hands. The other part of this that we also do that we find is a benefit because there's a common concern about the scars and about the appearance. So in addition to, of course, meticulous quality surgery, we also use a material called extracellular matrix, which we've been very successful with using for hair loss. And it originated in the use in cosmetic procedures to help improve the healing. And it's been really remarkable. We're able to really get fantastic healing using this material. So in your situation, I think the term facelift is appropriate. I think you have to evaluate the level of facelift you're willing to do and what you think will be a satisfactory result. I always caution my patients that it's one thing to be conservative, but most of the time people really want nice results. They don't want a little bit of extra skin hanging. They don't want a little bit of sagging that could have been addressed with a more aggressive procedure, but when budget or fear restricts someone, they don't always look at the remarkable benefits, they look at what's left over. So I tend to be more on the more aggressive side to try to get the most optimal result. And even with that, there's always a natural amount of regression, of elasticity of the skin that sometimes requires enhancements. In our practice, we always offer our patients the option of doing an enhancement if they need it, and because we have our own facilities, we're able to absorb a lot of those costs that can be a barrier or an obstruction for somebody in another situation. So I think you should meet with qualified, experienced cosmetic surgeons. There are a lot of people who do facelifts, and I think you have a lot of options at this time. And learning the type of facelift that you like by looking at the doctor's before and after pictures and looking at the style and getting a sense from the staff of the level of happiness that the patients experience when they've had their procedures. We do a lot so our staff can easily reflect on how really gratifying it is for them to see the transformation for our patients. And once you feel comfortable, then move forward with the procedure that you think will be most beneficial for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.